The U.S. Preventative Services Task Force recently published its recommendations for breast cancer screening. They advise that women at average risk for breast cancer begin screening at age 50 through age 74.
Although they do say that women with a family history of breast cancer, like a mother, sister, or daughter, should begin screening earlier by age 40 since they are at higher risk. But overall, the new guidelines are stirring controversy and confusion among patients. KCBD News Channel 11's Sasha Wilson talked to a breast cancer survivor who tells us what worked for her.
The decision on when to start annual mammograms is difficult, especially when you're getting conflicting information. One panel says 40, another 45. This week, the U.S. Preventative Services Task Force came out with age 50. But Marla Harbin is a breast cancer survivor here and was diagnosed under the age of 40. She knew something was wrong, but was turned away after her first mammogram.
And, the second time I was like, I'm not leaving, because I felt like I knew there was something the matter. And so I just said, when they told me that they weren't going to do it, I said, you're not leaving, call my doctor.
It took her 5 months of persistence to get a correct diagnosis.
So I had chemo, radiation, and a bilateral mastectomy. You've got to pursue things. You are your best advocate. You know what's going on with your body to some degree.
Many professionals believe that screening prior to age 40 can cause harm, such as false positive tests and unnecessary biopsies, and Harbin said she does understand that.
I did experience that throughout my treatment and some of the scans that I did, but I just find that, especially if you're doing breast self-exams, that doing the mammograms, it would be important to follow up. You've got to make sure, is this something or is it not?
She says even if you aren't at risk genetically for having cancer, you should perform self-checks and go with your gut.
I have 4 daughters, and the plan is for my oldest daughter to start having a mammogram when she's 30. You can't just go by your history, because I ran for years, breastfed every child, and that's supposed to help.
She says it seems like women are being diagnosed younger and younger now, and that in her case, she's glad she had early screenings. Sasha Wilson, KCBD News Channel 11.